Hello, and welcome to our webinar on preventive services for cardiovascular disease. My name is Jennifer Boniface, and I am one of the nurse analysts with the Provider Outreach and Education team. Today's webinar will focus on the Medicare Preventive Service Guidelines for cardiovascular disease screening test and intensive behavioral therapy for cardiovascular disease. So according to the American Heart Association, A Million Hearts 2027, every 34 seconds, a person in the United States dies from cardiovascular disease. However, conditions such as heart disease and stroke are preventable through lifestyle changes like eating healthy, exercise, and avoiding smoking, as well as managing risk factors like high blood pressure and diabetes. February is American Heart Month. Today, we're going to discuss two Medicare preventive services related to cardiovascular health: the cardiovascular disease screening test and the intensive behavioral therapy for cardiovascular disease. And both services are included in the preventive services benefits for Medicare Part B. Our objective for today is to provide an overview of the Medicare preventive services of cardiovascular disease screening test and intensive behavioral therapy for cardiovascular disease. And we will cover background information about cardiovascular disease, strategies for prevention of cardiovascular disease, and the Medicare Part B coverage criteria for cardiovascular disease screening tests and intensive behavioral therapy for cardiovascular disease. We'll begin with some facts. Worldwide, cardiovascular disease is the primary cause of mortality, responsible for an estimated 17.9 million deaths each year. Heart disease is the leading cause of death in the United States. For women, it accounts for approximately 1 in every 3 deaths annually. It is estimated by 2035, about half of all American adults will have some form of cardiovascular disease. So now let's discuss statistics related to the different types of cardiovascular disease. It is estimated every 40 seconds, someone in the United States has a myocardial infarction, and every 3 minutes and 11 seconds, another person has a stroke. Hypertension increases an individual's risk of heart disease and stroke. However, only 1 in 4 adults with hypertension have it under control. Research suggests that there may be a link between high blood pressure in midlife and increased risk of developing dementia later in life, especially with vascular dementia. Around 2 out of every 5 American adults has a total blood cholesterol of 200 milligrams per deciliter or higher, with an estimated 86 million having levels greater than 200 milliliters per deciliter, and almost 25 million exceeding 240 milligrams per deciliter. High cholesterol levels can put an individual at a higher risk for heart disease and stroke. So what is cardiovascular disease? Cardiovascular disease includes a range of conditions that impact the heart and blood vessels, including, but not limited to, atherosclerosis, hypertension, coronary artery disease, ischemic heart disease, heart failure, stroke, arrhythmias, and heart valve issues. In the U.S., it is the leading cause of death and disability, as well as the primary cause of hospitalization. Coronary artery disease is the most common type of heart disease. If left untreated, coronary artery disease can lead to angina pectoris or chest pain and myocardial infarctions, also known as heart attacks. Atherosclerosis is a major cause of CVD. It occurs when plaque builds up in the walls of the arteries. This plaque formation and buildup is a result of many factors, including elevated levels of low-density lipoproteins, elevated levels of triglycerides, high blood pressure, unhealthy lifestyle habits, and genetic predisposition. As the plaques build up, it begins to cause the arteries to narrow. This narrowing of the arteries prevents oxygen-rich blood from adequately circulating and reaching the tissues and organs of the body. As a result, it can lead to angina, heart attacks, and stroke. There are several factors that can elevate an individual's risk of developing cardiovascular disease. The first type of risk factors we will focus on are modifiable ones. These are ones we can control or change. The first modifiable risk factor is medical history. Certain diseases, such as hypertension, hyperlipidemia, and diabetes, can significantly increase the risk of developing cardiovascular disease. Hypertension, often called the silent killer, is usually asymptomatic. Uncontrolled high blood pressure may impact not only the heart, but also vital organs such as the kidneys and brain. Hyperlipidemia refers to the presence of excessive cholesterol in the blood, which can build up in the walls of the arteries. There are two main types of cholesterol: low-density lipoproteins, or LDL, also labeled as bad cholesterol, and high-density lipoprotein, or HDL, also known as good cholesterol. High levels of HDL offer some protection against heart disease, while elevated LDL can lead to plaque buildup in the arteries. Since elevated blood cholesterol often shows no symptoms, the only way to determine if it is a concern is through a blood test known as a lipid panel. With diabetes, persistent high blood sugar levels can damage blood vessels over time, leading to atherosclerosis and eventually cardiovascular disease. The next modifiable risk factor is diet. Eating a diet high in saturated fats and trans fats, high in sugar, high in salt, and low in fiber can lead to the development of cardiovascular disease. Experts recommend consuming foods that are low in salt, fat, and cholesterol as part of a heart-healthy diet. The third modifiable risk factor is not getting enough exercise or physical activity. When an individual does not get enough physical activity, they become more susceptible to weight gain, obesity, high blood pressure, high cholesterol levels, and high blood glucose levels. All these conditions can put that individual at an increased risk for cardiovascular disease. The fourth modifiable risk factor is weight. Excess weight can cause the heart to work harder to pump blood throughout the body, leading to an increase in blood pressure. Obesity has been associated with conditions that raise the risk of cardiovascular disease, including hypertension, diabetes, and hyperlipidemia. Smoking and secondhand smoke exposure are the fifth modifiable risk factors. Smoking and exposure to secondhand smoke can damage the heart and blood vessels, increasing the likelihood of developing cardiovascular disease. The carbon monoxide in smoke binds to the hemoglobin in the red blood cells, forming carboxyhemoglobin. Consequently, the body's ability to transport oxygen is reduced. Additionally, exposure to nicotine from cigarettes can increase a person's blood pressure. Smoking also reduces the levels of high-density lipoproteins. The next modifiable risk factor is stress. Chronic stress can promote inflammation in the body. This inflammation is associated with higher blood pressure and may contribute to reduced levels of high-density lipoprotein cholesterol. The last modifiable risk factor we will discuss today is alcohol. Excessive alcohol use can lead to increased blood pressure and increased triglyceride levels in the blood. Both of these conditions contribute to the development of cardiovascular disease. The updated U.S. dietary guidelines for Americans recommend individuals limit their consumption of alcoholic beverages. The other type of risk factors is non-modifiable risk factors. These factors are ones we cannot change or control. Age is the first non-modifiable risk factor. Men age 45 and older and women age 55 and older are at increased risk for cardiovascular disease. The next non-modifiable risk factor is sex. Men are at a greater risk for cardiovascular disease when compared to premenopausal women. This can be attributed to the protective benefit of estrogen, since it helps protect the heart against cardiovascular disease. However, once a woman enters menopause, her risk of cardiovascular disease increases due to the drop in estrogen levels. The third non-modifiable risk factor is race. Black and African American adults have a higher incidence of hypertension, stroke, and heart failure when compared to all other races and ethnicities. This increased propensity for these conditions may contribute to a higher mortality rate from heart disease for non-Hispanic Black adults. The last non-modifiable risk factor we will discuss today is family history and genetic factors. Having a father or brother diagnosed with heart disease before age 55 or a mother or sister diagnosed before age 65 may predispose an individual to the development of cardiovascular disease. Having a family member with conditions such as high blood pressure, hyperlipidemia, or diabetes may also contribute to the risk of developing those conditions as well. Before we move on, I want to discuss an additional factor affecting cardiovascular health. Research suggests that non-Hispanic Black adults and individuals with lower socioeconomic status generally consume fewer fruits and vegetables compared to other groups, although differences may vary depending on socioeconomic and environmental factors. Levels of physical activity have also found to be lower in people of lower socioeconomic status and people with lower educational levels. And this may be linked to factors such as distrust of medical professionals, lack of access to healthcare, lack of access and or availability of healthy foods, limited options for exercise, and barriers related to physical activity, such as limited access to walking paths or safety concerns when engaging in outdoor activities. There are several preventive strategies or lifestyle changes that a person can adopt to help minimize or reduce the risk of developing cardiovascular disease. These measures not only improve heart health, but also address key risk factors that contribute to heart-related issues. The first measure is consuming a heart-healthy diet. A balanced, nutritious diet plays a critical role in reducing cardiovascular risk. It's important to limit foods that are high in salt, saturated fats, and added sugars, all which may increase the likelihood of heart disease. Instead, the focus should be on foods rich in fiber, such as whole grains, fruits, and vegetables. Fiber helps manage cholesterol levels and supports overall heart function. Additionally, incorporating healthy fats from sources like nuts, seeds, and fatty fish, especially those high in omega-3 fatty acids, can further lower the risk of cardiovascular disease. The next strategy is to either drink in moderation or avoid alcohol altogether. While some studies suggest that moderate alcohol intake may offer a protective effect for the heart, excessive consumption is linked to a variety of heart problems, including high blood pressure, heart failure, and irregular heart rhythms. Therefore, it is essential to either drink in moderation or, for many, avoid alcohol completely to reduce cardiovascular risk. For those who don't currently drink, health experts recommend not starting in the first place, as this minimizes the potential health risks. The third preventive measure is engaging in regular exercise. Regular physical activity offers numerous benefits for heart health. It strengthens the heart muscle, improves circulation, and enhances overall cardiovascular function. Exercise also helps with weight management, burns calories, and reduces body fat, all which play a crucial role in lowering heart disease risk. Beyond that, physical activity can help reduce stress, which directly contributes to better heart health. Regular exercise also lowers the risk of blood pressure, or rather high blood pressure, high cholesterol, and type 2 diabetes, all which are major risk factors for cardiovascular disease. Activities like walking, jogging, cycling, and swimming can dramatically improve heart health, while resistance training helps maintain muscle mass and supports metabolism. The last preventive measure we will discuss is quitting smoking or never starting to smoke in the first place. Smoking is one of the leading causes of cardiovascular disease. It accelerates the development of atherosclerosis, the buildup of plaque in the arteries, which narrows and hardens the blood vessels, increasing the risk of heart attacks and strokes. Smoking also raises triglyceride levels, reduces the level of high-density lipoproteins or good cholesterol, and contributes to increased blood clotting, all which increase cardiovascular risk. Furthermore, smoking increases inflammation in the body, which is a key factor in the progression of heart disease. Quitting smoking can have a profound effect on cardiovascular health, even for long-term smokers. For those who have never smoked, avoiding smoking altogether is one of the most important steps to maintaining a healthy heart. The Centers for Disease Control and Prevention, in collaboration with the Centers for Medicaid Medicare and Medicaid services have established a national initiative known as Million Hearts. Now entering their 2027 phase, this program is committed to preventing 1 million heart attacks and strokes within a 5-year time frame. To reach that goal, the Million Hearts website encourages all individuals to follow the ABCs of heart health to help reduce cardiovascular risk factors and improve heart health. A represents taking aspirin as directed by a healthcare professional. Aspirin can help reduce the risk of heart attacks and strokes by preventing blood clots. However, aspirin therapy should only be taken under the guidance of a healthcare professional as it may not be suitable for everyone. A healthcare provider will evaluate the individual's specific health needs and risk factors before recommending aspirin use. B is for controlling blood pressure. Maintaining healthy blood pressure is crucial for heart health. Hypertension is a leading risk factor for cardiovascular disease, including heart attacks and stroke. Regular monitoring and managing blood pressure through lifestyle changes and medication as prescribed by a healthcare provider are essential for reducing these risks. C is for managing cholesterol. Managing cholesterol levels is another critical factor in reducing cardiovascular risk. High levels of low-density lipoproteins can lead to plaque buildup in the arteries, increasing the risk of heart disease. A balanced diet, regular physical activity, and medications, if necessary, can help lower LDL cholesterol levels and improve overall heart health. And S stands for don't smoke. Smoking is a major risk factor for cardiovascular disease. It damages blood vessels, raises blood pressure, and contributes to plaque buildup in the arteries. Quitting smoking is one of the most effective ways to improve heart health and reduce the risk of heart disease. Support programs, medications, and counseling can help individuals quit smoking for good. And you can find a link to that Million Hearts website in the title of this slide right here. Medicare offers two types of preventive services for CVD, the cardiovascular disease screening tests and the intensive behavioral therapy for cardiovascular disease. And we'll begin by discussing the cardiovascular disease screening test. This test measures the levels of cholesterol, lipids, and triglycerides in an individual's blood. The results of this test play a key role in assessing whether a patient is at an increased risk for developing atherosclerotic cardiovascular disease. The tests covered by Medicare for cardiovascular disease screening include total cholesterol, high-density lipoprotein cholesterol, and triglycerides. This is also known as a lipid panel. The lipid panel involves drawing a blood sample from the patient through venipuncture, which is then sent to the lab for analysis. These tests require the patient to be fasting 10 to 12 hours prior to completion of the service. For more detailed information about lipid panels and lipid testing, please refer to the guidelines outlined in NCD 190.23 lipid testing, and a link to this policy has been included on this slide. Additionally, I've included a link to the Encore presentation on lipid panels, which is available on our YouTube channel. Medicare also offers coverage for an additional preventive service for cardiovascular disease called Intensive Behavioral Therapy for Cardiovascular Disease, or the CVD Risk Reduction Visit. This preventive service is specifically designed to assist patients with reducing their risk of developing cardiovascular disease through early intervention and management. Intensive behavioral therapy for cardiovascular disease consists of three key components, including encouraging use of aspirin for the prevention of CVD for men 45 to 79 years of age and women 55 to 79 years of age when the benefits outweigh the risks. Screening for high blood pressure in adults age 18 and older, and intensive behavioral counseling to promote a healthy diet for adults with hyperlipidemia, hypertension, advancing age, or other known risk factors for cardiovascular and diet-related chronic disease. The intensive behavioral therapy should align with the 5 A's approach outlined by the United States Preventive Services Task Force. The 5 A's include assess, ask about, assess behavioral health risks and factors affecting choice of behavioral goals, behavioral change goals and methods, advise, give clear, specific, and personalized behavior change advice, including information about personal health harms and benefits, agree, collaboratively select appropriate treatment goals and methods based on the patient's interest in and willingness to change the behavior, assist, using behavior change techniques such as self-help and/or counseling, aid the patient in achieving agreed upon goals by acquiring the skills, confidence, and social and environmental supports for behavior change, supplemented by adjunctive medical treatments when appropriate, and arrange scheduled follow-up contacts in person or by telephone to provide ongoing assistance and support, and adjust the treatment plan as needed, including referral to more intensive or specialized treatment. And you can find additional information about intensive behavioral therapy for cardiovascular disease and NCD 210.11 intensive behavioral therapy for cardiovascular disease. Now let's review the Medicare coverage criteria for the cardiovascular disease screening test and the intensive behavioral therapy for cardiovascular disease. Medicare covers the cardiovascular disease screening test once every 5 years for patients with Medicare Part B that have no apparent cardiovascular disease signs or symptoms. There is no copayment, coinsurance, or deductible if the healthcare provider accepts assignment. Medicare covers one face-to-face intensive behavioral therapy for cardiovascular disease visit annually for patients covered under Medicare Part B. Please keep in mind that a minimum of 11 complete months must have passed since the last Medicare covered IBT for cardiovascular disease took place for Medicare to pay for the service. And again, I just want to reiterate, it's a minimum of 11 months. The patient needs to be competent and alert during the time of counseling, and the counseling must be provided by a qualified primary care physician or other primary care practitioner in a primary care setting. So before we continue, I'd like to review a pre-submitted question we received about which providers are qualified to deliver this service and the appropriate setting in which it can be provided. According to Medicare guidelines, services must be furnished by a primary care physician or other primary care practitioner in a primary care setting. Under National Coverage Determination, NCD 210.11, a primary care physician is defined as a general practitioner, a family practice practitioner, a general internist, or obstetrician or gynecologist. A primary care practitioner is further defined as a physician specializing in internal medicine, geriatric medicine, or pediatric medicine, or a nurse practitioner, clinical nurse specialist, or physician assistant. Additionally, CMS guidance in MLN 006559 Medicare Preventive Services define a primary care setting as a place where clinicians deliver integrated, accessible healthcare services and are responsible for addressing most patient healthcare needs, developing a sustained patient partnership, and practicing in the context of family and community. CMS further clarifies that they exclude emergency departments, inpatient hospital settings, ambulatory surgical centers, independent diagnostic testing facilities, skilled nursing facilities, inpatient rehabilitation facilities, and hospices from the category of primary care setting. And you can find a link to the MLN 006559 Medicare Preventive Services on the resources slide at the end of the presentation. There is no copayment, coinsurance, or deductible as long as the intensive behavioral therapy for cardiovascular disease is performed by a healthcare provider who accepts assignment. IBT for cardiovascular disease is telehealth eligible, and the requirement can be met through audio-only interaction. CPT code 80061 is used for billing cardiovascular disease screening test. This panel must include 3 specific tests: total serum cholesterol 82465, direct measurement of high-density lipoprotein cholesterol 83718, and triglycerides 84478. Documentation for the billing of 80061 must show that all three components were performed. The panel cannot be unbundled to bill for individual components if all are tested. This is a bundled laboratory test used to assess cardiovascular risk. HCPCS code G0446, Annual Individual Face-to-Face Intensive Behavioral Therapy for Cardiovascular Disease for 15 minutes, is used for billing IBT for cardiovascular disease. Additional information on billing the cardiovascular disease screening test and intensive behavioral therapy for cardiovascular disease can be found in the Medicare Claims Processing Manual, Chapter 18, Section 100 and Section 160. A link to that has been placed on the resources slide at the end of the presentation for your reference. So before we move on to documentation, I want to address another pre-submitted question we received. The question stated, why is Z13.6 not an acceptable code to justify medical necessity for Medicare Preventive Service 80061 cardiovascular disease screening test when the labs are truly for screening cardiovascular disease? According to the MLN 006559 Medicare Preventive Services chart, under cardiovascular disease screening tests, Z13.6, encountered for screening cardiovascular disorders, is the appropriate billing code for cardiovascular disease screening. This code may be used to support Medicare coverage for the cardiovascular disease screening test, CPT code 80061, when a lipid panel is performed as a preventive service. Under Medicare Part B, this screening is considered reasonable and necessary for asymptomatic beneficiaries when provided according to CMS guidelines. It is covered once every 5 years with no deductible or coinsurance. However, it's important to note that Z13.6 is specifically for screening purposes and should not be used for diagnostic purposes. And I'm not sure the person who asked that question, maybe if they were using it for diagnostic purposes, but I do want to stress that that code is used for screening purposes. If a lipid panel is ordered to evaluate symptoms or manage a known condition such as hyperlipidemia or a cardiovascular disease, Z13.6 is no longer appropriate. In those cases, a diagnostic ICD-10 code must be used. And this is especially important. Providers must ensure that clear documentation is included in the medical record to explain why Z13.6 is being used and that all submitted documentation supports its use for preventive screening. So for that question, I just want to stress it's important that you do say why it's being used to support that preventive screening. Otherwise, our reviewers will not know and they will assume it is for a diagnostic purpose. So I'm hoping that did answer that question for that provider. Documentation for cardiovascular disease screening tests should include date service was provided, signed and dated physician or qualified non-physician practitioner order for the laboratory services performed, test results, and documentation of any follow-up care and/or counseling that was given following evaluation of results, and any office visit notes for the date of service if applicable. Ensure all documentation is dated and signed with the provider's credentials. Documentation for intensive behavioral therapy for cardiovascular disease should include date service was provided, office visit notes for the date of service, documentation the patient was competent and alert during the time of counseling, and documentation that behavioral counseling intervention was provided by a qualified primary physician or other primary care practitioner in a primary care setting and was consistent with the United States Preventive Services Task Force's 5A's approach of assess, advise, agree, assist, and arrange. And again, ensure all documentation is signed and dated with the provider's credentials. Prior to completion of both of these preventive services for cardiovascular disease, ensure the patient has met the eligibility and frequency criteria for these services. Routine screening and ongoing follow-up care can play a key role in preventing cardiovascular disease. Medicare Part B provides preventive services such as cardiovascular disease screening tests and intensive behavioral therapy for cardiovascular disease to help healthcare providers identify and treat individuals at risk for developing CVD. So as a recap, during today's webinar, we provide some background information about cardiovascular disease, discuss strategies for the prevention of cardiovascular disease, and reviewed the Medicare Part B coverage criteria for cardiovascular disease screening tests and intensive behavioral therapy for the cardiovascular disease. This slide includes links to MLN 006559 Medicare Preventive Services chart for both the cardiovascular disease screening test and the intensive behavioral therapy for cardiovascular disease. It also provides links to the Medicare Claims Processing Manual, Chapter 18, Sections 100 and 160, as well as the encore presentation on the billing aspects of these Medicare preventive services. Please refer to this slide as a reference when reviewing the presentation. So we're now at the end of the formal presentation. Please remember, if you have any questions, please put those questions in the chat and select Send to all panelists. So before we answer questions in the chat, I want to address a couple of pre-submitted questions we received. So question 1 asked, are the HCPCS codes G0537 and G0538 considered screening services in 2026? The Centers for Medicare and Medicaid Services introduced HCPCS codes G0537 and G0538 in 2025 to support the assessment and management of atherosclerotic cardiovascular disease, or ASCVD risk. These codes remain valid in 2026. G0537 is used for ASCVD risk assessment. This involves administering a standardized evidence-based evaluation for patients who have risk factors such as obesity, high blood pressure, or a family history of cardiovascular disease. It is intended for patients who do not currently have cardiovascular disease diagnosis, but do have at least one risk factor. And this service can be billed once every 12 months or 5 to 15 minutes. G0538 covers ASCVD risk management for patients identified as having a moderate to high risk of developing cardiovascular disease based on the ASCVD risk assessment. It involves creating or updating a care plan that addresses risk factors and incorporating shared decision-making between the patient and the healthcare provider. And this service can be billed monthly for patients with intermediate, medium, or high risk of developing cardiovascular disease within the next 10 years and may include time spent with the physician or other clinical staff. So it is important to note that these services are not considered preventive services under Medicare. Medicare does not classify risk management as a preventive service, which does mean cost sharing may apply. Preventive services are defined by Medicare are specific screenings and checkups aimed at early detection and disease prevention, rather than broader risk management strategies. So for these two codes, G0537 and G0538, they are for doing risk management. And again, Medicare does not consider that a preventive service. So they would not be considered part of the preventive services for cardiovascular disease. So our second question asks, can a resident bill for intensive behavioral therapy for cardiovascular disease? And residents cannot bill independently for intensive behavioral therapy for cardiovascular disease. Billing must be submitted under a qualified primary care physician or other primary care practitioner. The counseling must be provided in a primary care setting. Per NCD 210.11, intensive behavioral therapy for cardiovascular disease, a primary care physician is defined as a general practitioner, family practice practitioner, general internist, or obstetrician or gynecologist. And again, as a reminder, a primary care practitioner is defined as a physician specializing in medicine, internal medicine, geriatric or pediatric medicine, or as a nurse practitioner, clinical nurse specialist, or physician assistant. Residents can participate in providing IBT under supervision, but the Medicare claim must be billed by the supervising qualified practitioner. And I am just going to take a look in the chat.
Hi, Jennifer. Thanks for sharing all of that great information. We have had no questions in the chat.
Thank you so much, Mary. If you do have a question, feel free to put in the chat and Mary will let me know at the end. Otherwise, we'll move forward. So please take a moment to complete the survey and share your feedback. We use your feedback to develop topics for future education. And you can access that survey by clicking either the link in the chat or by visiting the CMS Qualtrics page after the webinar. In a few minutes, you will receive an email thanking you for attending, which includes your certificate of achievement and a link to the survey. If you need contact hours for continuing education, they will also be in that email. And if you don't see that email, check your spam folder. However, if you called in, we have no way of you getting that email. So if you just email us at wps.gha.education@wpsic.com with the name of this webinar and the phone number you used to call in, we'll send you your certificate of achievement. If you think of any additional questions after today's event, you have 7 days from today to submit them. Send them to our education mailbox at that email address, wps.gha.education@wpsic.com, and put the title of this webinar in the subject line. However, if you have claim-specific questions, please direct those questions to our customer service department. As Mary, myself, and Poe, none of us have access to your claim information, and so therefore we're unable to look up claims. Also remember that we cannot accept any type of PHI or PII via email. And it does not look like we have any questions, so we're going to finish up this webinar. So finally, on behalf of myself, Mary, and all of provider outreach and education, thank you for attending today's webinar on preventive services for cardiovascular disease. As a reminder, this presentation will be posted as an encore presentation on the Training Center page on our website. Remember to take our survey with the link provided. We look forward to your survey comments and hope to have you join us at future events. You may now disconnect.